Lwenj kedo gi thoe mag nyithindo matindo manyuolo e kaunti ma Homa Bay oyudo mijing'o bang' riwruok ma ok mar piny owacho ma ong'ere ni Lwala Community Alliance chiwo ne migawo mar thieth e kaunti no mwandu ma itiyogo e woda ma mine konyore ute thieth ma opogore. Riwruogno ne ochiwo mwandugo ma omuonyo omenda maromo milion 2.6 ne chief officer e migawo mar thieth e kaunti no Laktar Kevin Osuri. Mwandugo idhi ke e ute thieth manie kor gwenge kata dispensary maromo 36 e kaunti no mangima kaka yor duoko chien midhiero kod thoe moko mayudo nyithindo ma inyuolo e kinde ma jonyuol konyore.
The main cause of maternal mortality or the main cause of mothers dying has been from hemorrhage, postpartum hemorrhage, that is bleeding after giving birth. And one of the modalities to sort that out is what we have here called an ASG. Yeah, it helps us with managing shock, especially after mother has bled after giving birth. But as much as we are also taking care of the mother, we are also looking at the health of the child, so that the child is born properly, they are able to breathe well, and basically live a normal life. And we also have unfortunate cases of high infant mortality.
So far, we have trained healthcare providers from 157 facilities through the training on helping babies breathe, through the trainings of obstetric hemorrhage initiative, through the training of emergency obstetric and newborn care.
I'd like to thank Lwala community for coming in and partnering with the county to ensure that we meet our targets in terms of reducing maternal deaths to zero. We are not proud of